Hello, my name is Stephen Grinnell, and I have a business called Energy Medicine, and this is my first podcast to talk to you about energy medicine. So, what is energy medicine? Energy medicine is you moving yourself, which generates energy, which helps heal your body faster. So it's the basis of rehabilitation, physical rehabilitation. Now I've been doing this for over 12 years and I've had a pain clinic in Stratford-upon-Avon for that long. I've seen loads and loads of different people. I've seen lots of different injuries. I've seen plantar fasciitis, ankle issues, knee problems, knee replacements, hip replacements, back problems, shoulder problems, neck problems, carpal tunnel, all sorts. So I've treated a vast array of injuries and I've seen lots and lots of people in my last sort of 12 years. Now what have I learned? I've learned lots. I've learned that you can treat lots of different people and you end up being a master of no specialist area. So what I've actually done is really focused into three key areas from a treatment point of view. So I do a lot of work with plantar fasciitis, ankle and foot issues. Lots of focus work on knees and knee rehabilitation and knee replacements, and also a lot of work on lower backs. I do help a few other people as well in different areas, but that's the main focus. Now, the reason for the podcast is that I want to reach a wider audience. My clinic's very, very successful. I'm working sort of 4 or 5 days a week where I'm near enough at capacity, and people are having to sort of book quite 2 or 3 weeks in advance before they can come and see me. So what I'm trying to do is reach a wider audience. And one of the ways of doing that is to start publicising some of my online courses so that I can help more people with some common problems in a very different and specific researched way. So over the last 12 years, I've seen probably 2,500 people, and because I've clustered people, I can do a lot of research where I do treatment, movement interventions, try different things, trial different things from the internet, see lots of different people to be able to get together what are the commonalities. And because I've got the time to do the notes, the research, process the information, I've refined my treatment processes over and over and over again so that they're very successful. My current treatment success rate at the clinic is 93%, which I'm pretty proud of and I've worked quite hard for. So within that, that's brilliant, that's great. I use different movements, it's energy and it's medicine, fantastic. But who am I? Where did I come from? How did this journey start? Well, I've always been very active. I did loads and loads of sport when I was younger. I used to play a high level of rugby and I used to do a lot of martial arts. Both of those sports are high contact and I got injured quite a lot because of the nature of the sports. So I've had hamstring problems, knee problems, back problems, shoulder problems, the same as most people that are in those type of environments. So within that, I've gone through the standard rehab process with the NHS, with sports physios, that type of process, and been okay. I think as you're younger, you tend to recover better. As I got a little bit older, I loved doing practical and outdoor activities, so I joined the Royal Marines, which was a fantastic experience. Really enjoyed it, right up to the point where I got injured on active duty, so I damaged my pelvis and ended up getting medically discharged with osteoarthritis. And that was a real sort of catalyst point, because up until that point I'd done sort of school and college, gone into the Marines, first proper job, really, really enjoyed it, did a few years, and then bang, it's all finished. Coming out of the Marines, I had quite a lot of support, so I had the opportunity to go to university and I did a sports science degree. Love sport, still played sport even with osteoarthritis. Still played quite a good level of rugby and played that for a few years. And obviously then within that process, I was doing a degree and learning all about sport and training and everything else. So of course you try a lot of stuff out. And I did all of those things as well. Little did I know that it was making my arthritis worse and worse and worse. And I think very much so. I was a young person. I was 23 when I was diagnosed. I was very much in denial. So I never really sort of thought anything more than, I really like doing this, so let's keep doing it. And I was just frustrated, I think. After finishing my degree, I went into teaching, so I started teaching in colleges initially. And that was all sport related, so sport, training, rehabilitation, how to improve, very much on a sporting process. So it was looking at analysis of movement, biomechanics, anatomy and physiology, all the things that you can think of. And I really enjoyed it, and I taught at colleges for quite a few years. Did different levels, so I did A level and sort of higher education, so I did degree level work as well, and really progressed and benefited a lot from that and really enjoyed it. But my personal journey was starting to get worse, so my practical applications for training and doing things started to reduce quite significantly because my arthritis was getting worse and worse and worse. So at the age of 23, I had to have a hip resurfacing, which is particularly young, particularly when I had it done, which would have been in 2006. And at that point, it was quite a big catalyst because it was a massive change from an operation point of view, but it was also a relatively new operation. So that meant that the rehabilitation was really slow and very cautious. So I was actually off work and incapacitated for nearly 6 months. And it was at that point I said, right, I've got to take my journey into my own hands. So I started applying all of the sports principles that I used to teach and work with people on, and say, right, let's do it. Let's me get into fitness and let's start moving and applying all the knowledge that I've got and look at what I can't do and look at how we can fix it. So that was really the start of my rehabilitation career. Over the next 4 years, I started to live in Bournemouth, so I moved from the Midlands down into Bournemouth, worked at different universities and stuff, and did some work down at Bournemouth University and Bournemouth and Paul College. So I was there for 5 years. And it was a brilliant experience by the beach, very, very sort of different sort of focus. Did a lot of rugby coaching and all the things that I enjoyed doing, which was really positive. And you've got lots of outdoor activities on your plate. So you can go sort of in the sea, you can do kite surfing, and then you can go around the New Forest and do crazy cycling. So I had a great time. In 2010, my other hip, the non-operated side, because I had bilateral osteoarthritis, was really starting to hurt, so it was really increasing in pain. And I've been to see the surgeon, and they'd advised to try and keep, for as long as possible, not to have the surgery, which is why I'd waited 10 years initially. Now, the main reason for that is because I was still very young, they weren't sure how long it'd last. Having an operation at 33, they were predicting 10, 12 years maybe. And obviously within that meant I would be in a wheelchair by the time I'm the age I am now, which obviously when you're a young person is quite frightening and it's not really what you want to hear. So what I looked at was, what are the alternatives? What else can I do? I did like people do now as normal, but in 2010 there was less opportunity, it wasn't quite as extensive, to look at alternative treatment. So I went through all the different alternative treatments that you can have for osteoarthritis. And one of the areas I found was a lovely lady in Cheltenham that helped do some treatment using Interex therapy, which is quite specialist. It's a medical device. It was developed in America and it works on pain and inflammation. So I was based in Bournemouth, she was based in Cheltenham. So I used to drive every Saturday for 12 weeks and had loads of treatment. The difference was profound. It meant that I didn't need a hip replacement for another 8 years. And that was the real catalyst for my rehabilitation journey. 2010 was also a big change because that was the year that my daughter was born. And I think within that really solidified me, as a person and family and all the other stuff. But it also meant that you suddenly got another person to consider, and that makes a really big change in your life, as anyone with children will know. And it meant that we were struggling for childcare and everything else. All of our family and friends, to a certain extent, lived in the Midlands. So we moved back to the Midlands in 2012, and I took the big step to say, right, this rehabilitation, this experience that I've had is amazing. I want to do rehabilitation. That's what I'm going to do. So I moved out of teaching, out of lecturing, which I'd done for the sort of previous 14 years. And I was good. I enjoyed it, but it had run its course. I got a little bit frustrated with the education system and some of the limitations on what you could or couldn't do. And also then where education was going, it was more about passing and less about excellence. So I took the big step. I was moving location and everything else. So that's what I did. I went into rehabilitation. I opened a clinic, started helping people. And initially it was all very much focused on joint replacement recovery. So I did a lot of stuff with hips and knees, did quite a lot of falls clinics, did some work for different charities, very much out in the community. And what I did was I looked at the Interex treatment and went, I really want to do that, but I need more of a medical background. I got lots of academia and I was bright, but it was more the case of having the qualifications in the right areas. So it meant I went and did a master's degree in rehabilitation, where I had a focus on hip and knee osteoarthritis and recovery. So basically looking at improving mobility, reducing pain, that type of thing. So that was my dissertation focus. And I did a big community project in Birmingham, where I worked at the different centres. It was part of their Be Active programme. And what I found was that I got a 24% reduction in pain, which is quite good considering there was no medication involved or any actual formal medical treatment in that way. But it meant that people were working and moving their bodies better. But the big thing was a massive increase in mobility, just under 49%. And that was with an age range of 60 to 89. And it was roughly 72 people on the programme. So it was quite a big programme. It was at different centres. It was over 8 weeks. So it was quite a significant change. And I ended up presenting this to the British Heart Foundation in 2015 because I was using some of their test protocols. I'd sort of looked at it and gone, oh, that works really well for a heart. That'd be really good for mobility. I'll apply it and we'll use it in a different way. And they were quite interested because it's, oh, that's a bit different. It's not been used that way before. Can you present on it? So I presented at their main conference, which is a little scary because while I have been an academic, at this point I'm working in a clinic and rehabilitating people. So it felt quite daunting at the time, but a great experience. Moving on from that, what I found was that I was treating lots and lots of different problems, and that meant I was constantly problem solving. So I would have someone come to see me with a frozen shoulder, somebody else with a neck problem, somebody with a lower back problem, somebody with sciatica, somebody with a groin issue, somebody with a knee problem. And so each patient was very, very different. So that meant that I was constantly revising what I was doing. I used to track everything from a treatment point of view on how they're progressing, what's the impact of what I'm doing, how much are they doing at home, are they doing it little and often and daily, do they fully understand everything, are they still taking medication, all of these sorts of things. So what it meant was that I was gathering lots of data. I write lots of notes, not quite as quick as I talk, but I do write a lot of stuff down and I correlate a lot of stuff. So it's looking at, okay, I've worked with 3 people with a similar problem. What are the consistencies? Because of doing research, looking at data, teaching background, suddenly it makes you look at things slightly differently. And I thought, well, okay, how can I help people consistently to get positive results? Now, obviously, from a business point of view, you want to have positive results. That's what people come to see you for. But also on a personal level, I like working with people. My goal is to help them. So my goal with everybody that I work with is a long-term fix, because you want to try and get to the root cause of the problem, put the time in to change some of the things and improve things so that long-term in the future, they have a good sort of life. They can go back to the activities they want to do, everything else. So my client base is quite large, but the actual client life cycle is years, not months or weeks, because invariably I fix them for one thing and they come and see me for another. So a good example is somebody has one knee replaced 1 year, and then 2 or 3 years later they need the next knee replacing, and that's when they call and come back and see me. So it is a really big time lag. Now, all of this is fantastic, and obviously if you see me in person it's always different. So what have I done differently, or why am I doing this? What I'm trying to do is to focus people to look at things slightly differently. We've had quite a traumatic time. We've gone through COVID. I experienced COVID quite differently to a lot of people because I was fortunate enough to work at the QE hospital in Birmingham, rehabilitating COVID patients. So people that have been really poorly with COVID, had a lot of respiratory problems, renal problems, they might have been prone, they've been really poorly in hospital. And my job was to help get them out of bed and get them moving again, so bring them back to normal. And that's where a lot of the lower limb elements have come from, with balance, walking, foot problems. Because of proning, you're lying on face down on your front, and that bends your feet back. So we had to use a lot of splinting and all sorts of things, which I'd not experienced before. So within that, it was a great learning experience. But more importantly, it was a learning experience for everybody. So you were on a level playing field, and it meant that people had to think differently. Now, in thinking differently, it means that you have to solve problems differently. If you go and have physiotherapy at a hospital, because of the volume of people and the hospitals are overloaded, they have to make a very quick assessment. They decide what the problem is, and then they have a set sort of exercises, one size fits all, which they print off and give you and say, do these exercises and they will help. And obviously they're very generalised, so the idea is they fit everybody. Well, everybody isn't everything. It's a bit like, well, okay, how can you modify the exercise? Well, there's a bit of limitation. You can do a bit of this or a bit of this. Or actually, with your problem, don't do number one, but you can do the others. So it's almost like they're trying to make best of a situation as opposed to genuinely helping the individual. And obviously, within the clinic, that's easy because I see people one-to-one. So how can I develop something that more people can use and access, and they can use it online, but it's a program where you cover all the bases, so you can do the rehabilitation, you can explain about how energy and movement and all the other stuff work, but how does that work into the bigger picture? So how can they access it and then modify it? So what can you do differently? And that's what I've been working on. So I'm working on trying to reach more people, and this is the year. I was aiming to do this around when COVID hit, and like everybody, you have almost a pause, and the pause has been about 3 years. So within that, where I'm at the minute is that I've got a very successful clinic. I've got some really good online courses, and I'm working to help more people recover from different key areas. But all of this is based on my own research within my clinic. So everything that I talk about is my experience, learning, training, courses, reading, all the other stuff, all pulled together in one to be able to help as many people as possible. So one of the ways that I do that is I do quite a lot of specialist masterclasses where I do live video events and people ask me questions and we talk about things and we look at things from a completely different perspective. So just to give an example, one of the key things that I do is plantar fasciitis, and one of my key pet hates is insoles because of how insoles work. So even custom made insoles are all designed to correct a problem while you're standing or sitting, but not while you're walking. So that's great. I can stand up and it helps my foot in that position. But as soon as I walk, all the support and everything that the insole's meant to be doing is lost. And it's also relying on how good your shoe is. If your shoe is really good, then obviously it helps with support. If it's not so good and it's, say, loose fitting or it's quite old, the benefit of the insole is lost. The other challenge is that a lot of the insoles focus on supporting the arch, and that's not normally the problem. What you want to try and do is build up the muscles of your foot. So I look at things quite differently. The other thing also is that lots of people say to me, but there's loads of stuff on the internet. And that's true, there's tons of stuff. Some of it's really good. But what I find with a lot of rehabilitation and a lot of sort of medical sort of elements is it's all too either general or too advanced. So some of the movements are really quite good if you're further along in your rehabilitation. What I tend to find is that people need smaller steps initially before they can take the bigger steps. And once they get going, they do quite well. So all of my courses, all of my programs, all of my work is focused in that sort of way. So it tends to be over 3 phases. And I do what I call a 369 approach. So it's either sort of 3 sort of core modules, 6 modules, or then a further 9. So you might end up doing 18 modules. Well, if you think about that as a process, that's quite a lot of input, quite a lot of change, and there's quite a lot of variation then within that. And what that allows for is for you to be able to take those small steps, consolidate all the changes. So you might need to change how you move, how you stand, how you walk, how you bend over, how you twist, all of these things. It allows you time to be able to do that and reinforce those changes so that they take effect, so you have a long-lasting fix to a problem. Now, why energy medicine? What's special about energy? Well, we are energy. We're just vibrating molecules. So we're various different levels, atoms, energy that's just vibrating, and that's what makes us. And our bodies are quite clever because they work very much like a hybrid system. And that hybrid system is chemical and it's electrical. So a lot of our nerve conduction, for instance, is electrical, roughly 98%. The other 2% is chemical. Now, a lot of people don't realise that, but that obviously links into things like pain relief, anti-inflammatories, all the other bits that people take for granted just as two obvious things. The other thing is that if we're a hybrid system and we're electrical and we're chemical, obviously we're very used to supplying our chemical system with food and nutrients and diet and these loads and loads of diet. So that's quite a key sort of factor, and that's an area that I'm working to explore and do more work in. But the flip side is electricity, the hybrid side. So our whole body is covered in what's called fascia, which is a tensile sort of structural element. It looks a bit like hemp rope, so it's three main strands that are twisted together. And those twists form a lot of strength, and it's about as strong as steel from a tensile point of view. And that holds our body in what you see now. So it holds everything together, it supports all of your organs, it's around all your muscles, or your bone, or your tissue, your skin, everything. So it provides you with structural support. And it's clever for two other reasons as well. One, it's got a lot of collagen, other bits, and it's all different sort of chemical elements, but it holds quite a lot of water, so fluid's quite important, and we all know that water's important for us. But it also stores electricity, and in storing electricity, it allows things to happen, communication, but also things like muscles firing and energy and all the other points. So it actually helps everything, but at a cellular level, so less at a functional level. So blood supply supplies nutrients to the muscles in the form of sugar, protein, fats. But what this does is supply energy to the cells. So it's that next level down, and it's what keeps you going all of the time. So if I was to tell you that roughly 40% of the calories you use are used by your brain, so it's used by cognitive activity. The other 60% is used by moving, and that's reducing because people are doing less. So when you go out for a walk, what that does is it uses some of your chemical energy, which is great. It's using your muscles, helps strengthen you up, it can help psychologically, give you a bit of brain space. But it also, because of all the movement, it's causing what they call piezoelectricity, which is a bit like a switch on a lighter. So if you've got a lighter, no gas in it, and you keep flicking it, you generate sparks. Those sparks are electrical. So those sparks are happening in your body as all the fascia is all moving as you move. And what that's doing is generating more and more electricity. So when you go out and about for a walk, you feel better psychologically, you feel better chemically, but you also feel better electronically. You're not always aware of that, so people don't know. It's not what's talked about. It's not in mainstream media, but that's how your body works. So if that's the case, energy is a really crucial part to your rehabilitation. Now, a lot of people, there's a lot more awareness on diet. I'm a lot more aware of diet and certain foods and certain food groups and sort of things like chemicals and pesticides and all the negatives around food, and also a lot of the positives, and there's lots of different diets that you can do and all sorts to achieve different goals. But no one talks about energy. Now, energy is really important because if you're really run down, your body can't heal as quickly. If you're in a position where you're actually, your body energy, your electrical energy is very high, you heal very quickly, which is why young people heal much faster. The other thing to bear in mind is that until the age of 3, your DNA is set up electronically as replacement. So if you were to cut the very tip of your finger off as a 2-year-old, that part of your tissue can regrow and actually replace. As soon as you go past the age of 3, roughly 3, your cognitive activity, your brain activity is much higher. So because your brain activity is much higher, your DNA has to flip from replace to repair. And you do most of your growth and repair when you're asleep, which again links into your energy and your systems and your nervous systems and all the other pieces. So what energy medicine is, it's using your body's electrical system with movement to help rehabilitate your body. So movement helps rehabilitate, but it's quite fine-tuning, and it's a much bigger picture than I've gone to see the physio and here's 6 exercises to do. There's a lot more to it than that, as you'll find out over the coming weeks and months, because I want to talk about lots of different topics and subjects that relate to rehabilitation in lots of different areas. So I hope you've enjoyed this. I'm a bit of an expert in certain areas and pretty knowledgeable in most. I've done lots of rehabilitation. I've worked with lots of different patients and people over the last 12 years. And I continue to work with people in that environment. So what I'm working on is reaching out to be able to help more people. Catch up soon. The next instalment will be on pain and rehabilitation.